what makes up a key influencer today?
Yeah, it's a good question. I mean, the way we did it in the past, which was a couple of years ago, is if someone wrote at the New York Times or the Wall Street Journal or, JAMA or wherever, we said, okay, they're a key influencer, period. But now what we see is actually what's relevant is, do people care about what you write? And so one of our algorithms actually has 57 metrics in it. And we look at things like how often Google indexes your headlines. What is the blog to comment ratio? How often do people pass your information along? And what you're really seeing is if you do something that is useful, people will move it around online. And so those are the folks who are the true influencers. They can be media. In fact, they often are journalists. But they're just as often, when you get into a disease, they're forum posters, they're bloggers, they're people who are dedicating time to do video on YouTube. These are folks who are absolutely passionate about getting out the right story. And it's interesting because online is the ultimate self-filtering system. If you are saying things that are useful, people are going to absolutely share it.
Back to kind of that theme of key influencers, when we started working with WCG, ShareCare, we started on some simple projects of, let's look at oral health or fibromyalgia, and let's really study who the key influencers out there are. And when the data came back and we looked at all the different methodologies that created it, I had never heard personally of almost anybody on that list. And I can only imagine, being someone who's kind of fluent in web search and health search, that you would think I would know who those people were, and it would be easy for me to find them.
If someone knew, you probably would know.
Yeah,
I would give you that.
Would probably know them, and I was really shocked that these influencers, that are on this list, typically aren't these trusted health and wellness brands that we've kind of grown up, having a part of our healthcare.
Right.
But and so what I think is going to be really great about SharecareNow is on a monthly basis we're going to start publishing to the public who are making these top 10 lists, which I think is going to be really helpful for someone who's been diagnosed with diabetes, or their child with autism, or a loved one that maybe potentially just had a brain aneurysm, to be able to quickly find, hey, here are the top 10 people on the web. They're one click away that you can find, today. And I think that's kind of very core to what, I know you've always told me about WCG,
right,
and what ShareCare believes in is, how do we not just sit back and kind of hold this data close to ourselves so it just benefits us, but how do we start to share these insights in scale so that not only the average person has access to it, but these trusted health and wellness brands that are becoming more and more involved digitally.